Hi, welcome to Focus with Big Smith. My name is Leroy Smith, and this morning we'll be speaking with Dr. Frank Anthony, Minister of Health. Welcome, Dr. Frank Anthony.
Well, thank you very much for having me in your program.
All right, before we get into the meat of today's discussion, Dr. Anthony, you've been away from active public life for 5 years. You're now back. How have you been dealing with the late nights at work, being away from the family, and so on? How is it going? How is Dr. Singh? I haven't seen her a bit.
Yeah, well, I wouldn't say we have been away from public life because while we were in opposition, we were still involved at the level of the parliament and doing things in the public. Maybe it was not as pronounced as it should have been, but we were always out there. But in terms of coming back and managing a ministry, and especially like the Ministry of Health, because of the pandemic and so much more that is happening, we have been spending extended hours in the ministry and working to make sure that we have good coverage of the pandemic, and the family is doing okay.
Okay. Uh, Clearly, you have a plan for the COVID-19 pandemic. We've seen the operationalization of the COVID hospital. We've been seeing increased testing and so on. What does your plan mean for the Guyanese people?
Well, first of all, for us to get an understanding of what is happening with COVID, the most essential thing is to ensure that we can test. Because without testing, we wouldn't know what's the prevalence of the disease. And therefore, one of the very first things that we did when we came in is to ensure that we build that testing capacity. Now, when we came in, on average, 21 tests or so were done per day. And we have changed that. So now we have the capability of doing up to 600 tests per day. And that's with one shift. We can even increase that and go even further. And my intention is by the end of the month that we will be capable of doing at least 1,000 to 1,200 tests per day. So with testing, we will have a better appreciation of how many people are positive and so forth around the country. We have had another challenge, and that is when you do testing in the interior, one, to get those samples out to Georgetown has been a problem. So we had to resolve that as well. So we do sample collection on particular days when flights are there so that we can bring those samples out to Georgetown. So there have been a lot of things that we have been changing and making sure that we have the capacity to be able to do testing. And I think now we have a better system in place. Sample kits were not available around the country. We have rectified that. Within a couple of weeks, we were able to get in at least 40,000 kits into Guyana. And so we were able to ramp up our testing. And because we have been now testing more, we have seen a lot of persons probably who were positive. We're now seeing them displaying the signs and symptoms, or even those who are asymptomatic. We have been able to test them, and we have the numbers that we have now.
How do you intend to bring the numbers down?
The numbers would only come down if we can get compliance. People, this thing is spread by people. So if you have an infected person and they're not complying with the measures that we have in place, they can spread it to somebody else. But with a virus like this, part of the challenge is that a lot of people who might have the virus, they don't know because they're asymptomatic. So about 80%, 81% of the persons who have the virus don't even know that they have the virus because they don't have any signs or symptoms. Or sometimes they can be what is called pre-symptomatic. That is, before they display any signs or symptoms, they are also infectious. So it is a very tricky disease in that sense, and therefore people would have to wear their masks if they're going to prevent these infections. And one of the challenges has been to get people to comply with these measures. We have mandated now that mask wearing in public spaces, in shops and so forth, are compulsory. But yet when you go around the place, you would find one or two people still not complying. And that can lead to spread. We have talked to people about social distancing, and you would know that there are places where people still do not observe these simple protocols. And the rationale for social distancing, so for example, why are we telling people stay at least 6 feet from each other? We are doing that because if somebody sneezes, those droplets can travel at least 6 feet. And if you come in contact with infectious droplets, then you can get infected. If you're in an indoor environment, the latest science is now showing that apart from droplets, you have aerosols. These are tiny particles that can remain suspended in the air for a protracted period, in some cases more than an hour. So if you have a person who is infected with COVID, sneezes in the air in an enclosed environment, those droplets remain suspended, not droplets, but aerosols remain suspended, and somebody entering that room without a mask can become infected. So we have to understand how this thing is transmitted and then take the mitigating measures to prevent them, right? And we have been talking about this, we have been putting out the measures, and we really want people to comply with them, because if people comply with them, then all of us would be much safer. But compliance is a big thing, and we have to constantly remind people why these things are necessary.
How do we address the issue of compliance given the extension of the COVID-19, of the uh, curfew timing, which some people would have interpreted as an opening up of the country? So how do we address the issue of compliance with that, and also what are the challenges that the ministry and the state is having with respect to enforcement?
So compliance has nothing to do with whether you have a curfew or not, right? So if you are in a public space at 6 o'clock and there's a curfew, you still have to wear your mask, right? If it's at 12 o'clock in the night, you still have to wear your mask if you're in a public space. So to link the two things might not be the most appropriate way of addressing the issue. When we had put restriction of movements, for example, with a curfew, the intention was that people would get home by a certain period of time, and therefore we would reduce social contact with one another. If you don't have essential business, it doesn't mean that you have to wait until 10:30 to get home. If you don't have essential business, go home. So having the curfew hours shifted back a little bit does not mean that you have to stay out. And it should not be interpreted that way. One of the reasons why we have shifted those hours, because some of the businesses, for example, you have takeouts and so forth, they want to be able to offer a service, and we wanted to facilitate, because on the other side of this coin is that a lot of people have lost their jobs. A lot of people don't have a steady source of income, because since the pandemic started here in Guyana, we have had challenges where a lot of people were sent home and they don't have a regular job. So we need to balance the safety measures with some of the things that we are doing with the economy. And if we are going to allow some businesses to operate, they have to operate in a safe environment. And also the people who would patronize such businesses would have to ensure that they take safety measures. And so we can have that balance, right? We can do both things. We can have our public health safety measures in place, and we can also have the economic balancing, so that people can get their jobs, people can get some money, and be able to take care of their family. So that's what we are trying to achieve here. And I think the public need to act responsibly as well. So we shouldn't say that because it's 10:30 that somehow that is wrong. What we should do is to ensure that we all act responsibly, and if we don't have any business on the road, then go home. That's the safest thing to do. One of the other things that we have noticed is that bars are closed, and that has remained so for all the duration of the orders that we have put out. And the simple reason, if you go to a bar, one, to drink, you have to take off your mask. And if you don't know who is around you, then you can take off the mask. You can infect, if you are positive, infect somebody else, or they can infect you. And that is why we have prevented bars from reopening. And as people take in alcohol and they get drunk, they discard all the rational measures that you need to take. So bars are closed, and that has remained in force. And so if there are bars that are operating, they are doing so illegally. Indoor dining, for example, has been closed. And there's a rationale for that because, as I mentioned, we have noticed from the other places that you can have circulation due to aerosols. And therefore, if you open up indoor space and they don't have things like HEPA filters and so forth to get rid of any viral particle, then you're putting people at risk. So those industries or those things that we think are still risky, we are not allowing them to open. So we are trying to have that balance between the safety of the public and also trying to ensure that some businesses can open with safety measures. And that's what we've been working on.
We're speaking with Dr. Frank Anthony, the Minister of Health. We'll take a very short commercial break and we come back right here on Focus with Vic Smith. Welcome back. We're speaking with Dr. Frank Anthony and the Minister of Health, and we're speaking on the issue of the coronavirus variant and its management. Dr. Anthony, before we went to the break, we spoke of the need for responsible behavior by members of the public and also the need for government to think about the economic situation the country is in because of COVID and so on. How do we address the issue, or how do you explain the issue of increased deaths, or the deaths we're seeing, I should say, the deaths we're seeing with respect to COVID-19 as compared to a few months ago?
Yeah, you know, if we are following what is happening globally with the pandemic, about a day ago, the WHO statistics would show that we have more than 50 million people who have been infected with COVID-19. And of those persons, you had about 1.25 million persons who have died. So this thing is spreading. Globally, we don't have a special medication specific for COVID, right? And because we don't have that, once somebody get infected, and if they get the more severe or critical forms of COVID, they would have various challenges in the hospital. So we are no different from what is happening globally. And without a very specific medication for COVID, we are going to continue to have those challenges. We don't have a vaccine as yet. So despite the hype for a vaccine, there are many vaccines that are at the candidate stage, but they have not been confirmed, and they are not as yet manufactured and distributed, right? So we don't have a vaccine. So in the meantime, the best way that we can help to prevent COVID is to take precautionary measures, which include those simple things that we've been telling people. The 3 W's: wash your hand, watch your distance, wear a mask, right? So you prevent. However, if people do get sick, then we have to ready the health system to be able to take care of people, which is what we have been doing. So at our National Referral Hospital, that's GPHC, we have been able to expand the amount of beds that we have at GPHC to take care of COVID-19 patients. We have also set up a special ICU at GPHC that is only for COVID-19 patients. And again, when we just came in, one of the challenges that GPHC had, they did not have enough ventilators, right? So we were able now to secure ventilators for them to ensure that if any patient needs ventilation or they need that type of care, that they would be able to get that. At the regional hospital, most of our regional hospitals did not have the facilities to provide care for COVID-19 patients. This is something that we have addressed by sending out ventilators to these regional hospitals, by doing training for our doctors to make sure that they can handle COVID patients, by providing them with PPEs so that they can be safe when they're dealing with COVID-19 patients. So we have come a long way in just a couple of weeks by increasing that capacity to manage COVID-19 patients. We have also taken the Ocean View facility, which was basically a shell, and we have converted that into a hospital, meaning that we have now put in beds in there, put in all the relevant equipment. And so in the first phase, we were using it more for mild patients. And in another week or so, we want to now be able to offer the continuum of service from mild patients right up to critical patients. By the end of this week, I am hopeful that we can get a 25-bed ICU up and running at Ocean View. We have already put in all the lines for the various medical gases and so forth. And we are right now doing some finishing touches so that we can have that 25-bed ICU in place. So we are building that capacity. Now, in terms of deaths, one of the things that we have seen with the persons who are dying in Guyana is that most of these persons, they have what is called comorbidities, meaning that they have other illnesses, other underlying illnesses. So we have seen persons who have had diabetes, persons who have had hypertension, persons who have had cardiovascular diseases, cancers, persons who had HIV, TB. These persons, when they came in and they had these underlying conditions, in most cases they're not controlled, and then in addition to these conditions, they had COVID. They had a much harder time fighting off the disease. In a lot of cases, they started out by being in one of the wards that we have, and then they start decompensating, and, meaning they're having difficulty in breathing. And they ended up in the ICU, and in a number of cases, they did not recover. So we've had these challenges, but we continue to work with them. And this is a global problem, where persons with comorbidities are at higher risk for this disease. We have also noticed that persons who are older would have a harder time with COVID. And in fact, for the amount of persons who died, those that would have been 80 years and over, we had a 33% mortality rate. Those who are 60% and over, it's about 20-something% mortality rate. So age is a factor in all of this as well. And when you combine age with comorbidities, meaning you having an underlying condition, you are even at a higher risk. So one of the takeaway points from all of this is that persons who are older and who have underlying conditions like diabetes or cancer or any one of the chronic non-communicable diseases should take the extra precaution of using all the prophylactic measures that we have been talking about, right? So when they're going out in the public, they need to wear their mask. When they're, in a shop, they need to maintain that distance. And they don't need to be in the public all the time. They should take those precautions. Send somebody who is, if you don't have to go, send somebody to do that for you so that you can stay at home if you're not working and be away from persons who can expose you to COVID-19. So these are precautions that people ought to take.
On the issue of age and so on, as you mentioned earlier, what has been happening? What are the stats available to the ministry as it relates to children being infected with coronavirus, and what is happening at the maternity level, at the maternity ward and so on?
We do have a few children, I think under 15 years of age. We've had a couple cases of children being infected. And you would have seen that now that we have opened back schools for certain age categories like third form, fourth form, fifth form, that at President's College, for example, all the children coming into the dormitories, we decided that we are going to test them. And as we start that process of testing, we have found at least 8 of them who are positive for COVID. We have also started that process with all the dorms that are in the different regions. And I'm certain we'll find among this population that we'll find children who are positive. So yes, we have seen positive cases in children. However, and this again is the global trend, positive coronavirus cases in children are normally, it's normally a very mild disease or almost asymptomatic disease. So the children would be infected, they themselves don't know, they don't have any fever, no headaches, no nothing. The only way you know that they're positive is when you do a PCR test. And that is the same problem that we've had here. So yes, we do have cases of children, but they've all been very mild. We haven't had any problematic case as yet.
The maternity ward.
We have had one case with a child who came in, and this was last week, who had leukemia. And that child also had COVID. So if that child did not have leukemia, then that child would have survived the COVID. Unfortunately, that child passed away. So we've had these types of cases as well. In terms of maternity cases, again, GPHC, we have been receiving a number of cases from the interior. And when they come out, because of the complications that they might have, when they come to Georgetown, one of the precautionary measures that are taken is to do the PCR tests. And we have had a number of cases where these persons have been positive, but they have been appropriately treated at GPHC, and they've gone on to give birth to their child, and that has all been done in a very safe manner. And even in the period of recovery, we have used the Ocean View facility to keep mothers safe along with their babies to ensure that, they can recover appropriately.
On the issue of the persons being isolated and home quarantine and so on, this does have some bearing on the psyche of persons and so on. What is there a system in place at the ministry to deal with mental health issues as a result of this, and also the gyms and so on are closed, parks are open to revised timings? How do you address the issue of obesity and other physical health problems?
Well, let's start with the first one, or maybe the last one, with obesity. And one, we want to ensure that people exercise. So even in a pandemic, you can do some exercise at home. And the recommendations is that you do at least 30 minutes of exercise every day.
The right exercise. So how do they know what's the right exercise?
The right exercise is, at least it should be a little bit vigorous, so a little bit of jogging or, even walking around your home several times. That should also suffice. But at a minimum, do about 30 minutes of physical exercise every day. While that might sound like
Do you exercise?
I do, yeah.
How long?
Sometimes I get the 30 minutes, other times I don't.
Okay.
And I really need to build that routine. But as simple as that sounds, it's something that most people don't do. And life has become quite comfortable for a lot of people, so they're not, walking to work or anything like that. They get a drop. And therefore, we need to look at that. You would also note that over the years, a lot more Guyanese have expanded on the waistline. They've become a little bit more obese. And that's because they're consuming more food but not exercising appropriately. And when you're obese, you can put yourself at risk for a number of other diseases, including cardiovascular diseases. So that's something that we have to pay attention to. In the pandemic, again, it does not stop you from exercising, and therefore we should continue to exercise. And those of us who have not been doing it, we need to also develop a regime of exercising. Gyms, one of the things that we have done in the latest order is to work with gym owners to try to put some measures in place for the reopening of gyms. And we have done that in a partial way. So if somebody is going to go to a gym, they need to make an appointment with these gyms so that the gym is not overcrowded. Because what you don't want is for persons to go there, it's crowded, they can't keep the distancing and so forth, and then that becomes a potential hub for spread. So we want to avoid that. And so while we have allowed for gyms to reopen, those things are done with special conditions that are attached to it. And we have put the onus on the gym owners to be able to guarantee that these conditions are met. So in that way, they can open, but they have to open safely. So that's another thing that we have tried to accommodate.
Take another break, and when we come back, we'll continue speaking with, we go to the last stretch of our interview with Dr. Frank Anthony, Minister of Health. Welcome back. We are continuing our conversation with Dr. Frank Anthony, the Minister of Health, and we're discussing the issue of COVID-19. Dr. Anthony, before we went to the break, I cut you short, but I'd also asked you to speak on the issue of mental health in this period of COVID-19, where persons, the isolation and being at home could have a bearing on the psyche.
Yeah. And that's very important, because when people are at home and they start thinking about all kinds of stuff. And we have seen that people are more anxious. And when they look at the news as well, and if they're seeing all these things about COVID and not maybe making sense of it, they can become more anxious. We have seen more cases of depression and so forth. At the level of the ministry, we have a couple of options that are available to people. So one, there are hotlines that you can call where you can talk to people if you have any issues that you want to raise. You can talk to those persons. We have at least one doctor who is constantly on the line and are able to answer whatever queries people might have. So that should assuage whatever information you might need. So that's one avenue that we have available. Secondly, we have started to open up a lot of our primary care facilities. And at the primary care level, about 3 weeks ago, we have conducted training with our mental health department for primary care workers. So one, that they can better detect persons who might be depressed or who have anxiety symptoms and things like that, and be able to offer them advice. And if we determine that they should refer high up in the system for more a network of people who can offer advice to those who need advice during this period. And hopefully that would help. It might not solve all the problems, but it certainly would go a long way in helping people.
You spoke of depression, the numbers increasing, and so on during this period. What about domestic violence and abuse?
That too, I've seen some global figures where they have spoken about the increase of domestic violence, and that is something that we too have to be on the lookout for.
150 million thereabout has been allocated for, I think it's the frontline workers.
Yeah, risk allowance.
Risk allowance, yes. How is that being
Distributed
and so on to our workers?
So we have asked every regional health officer and the REOs for every region to supply to the ministry the names of the persons who would have been in the front line. And we have sent out a definition from the World Health Organization of what do we mean by a frontline health worker. And based on that definition, there are 3 levels of risk. And so we've asked them to prioritize the workers in these 3 categories. We have now received most of those lists, and the ministry's administrative department are now putting that together. And they would now be able to send those out. I think they have to determine whether they'll do it as part of their regular salaries at the end of the month, or whether they'll pay it as a special bonus. So they're working out the mechanics of that, but one way or another, the risk allowance would be available to persons starting from this month.
Okay, so Dr. Anthony, we started on a personal note, we got into coronavirus discussion, and so we're now going to end on a personal note. And to be very clear, I want to read a quote here, a quote without misquoting the quote. It says, as leaders, we are often called upon to make tough and selfless decisions. In this instance, I did it with the belief that it was in the best interest of the party and country. Are you familiar with the quote?
I think I am familiar with that quote.
Okay, the quote, you quoted in Starbuck News.
Yeah.
Starbuck News quoted you here with this quote when you withdrew from your presidential candidacy at the party level through your support behind Anil Nandlal, who is now the Minister of Legal Affairs. Anil Nandlal is not the president. Irfan Ali is, Dr. Irfan Ali. And so you're now a part of Dr. Mohammed Irfan Ali's cabinet. How does it feel working for Dr. Ali, and also what are some of the qualities you might have admired of him within the last 3 months that he's been your boss?
Yeah. No, well, you know, the relationship between all the leaders of the PVP does not start from now. We have all been in this party for a number of years. We've known each other. We have been colleagues, comrades for a very long time. And we work as a team. So it doesn't matter who is president or not. At the level of the party, we have devised a manifesto of what we feel we can deliver for the Guyanese people. And we work to ensure that that is delivered to people. Under the leadership of Dr. Irfan Ali as president, he is committed to doing so, and all of us are here to support that vision because we want to ensure that the Guyanese people can have a better way of life, can have better prosperity, and that's what we're all working for. Personally, I have been working with the president very closely because, you know, this pandemic is one of the biggest problems that we have in this country, and the president has given me all the support that I need to fulfill the mandate of dealing with coronavirus in Guyana. Whatever resources I need, we have been able to get that. A lot of monies have been given to this ministry to be able to deal with issues of drug shortages, getting PPEs, paying risk allowance, buying equipment. So we have been working very, very close together. And because of that closeness and that relationship, I think we have been able to accomplish quite a lot in this ministry. So I want to compliment him for his leadership and at times his guidance as we move this process forward.
I can recall you mentioning the qualities you admire. The it's about three. It's
Um,
3 months in office, so give us
so
three.
um, I think there are quite a lot of qualities that the president has. One is he has a macro vision of where he wants to take the country and how he wants to lead. He has that personal touch because he would reach out and have discussions with his ministers to point out perhaps how can we do this or how can we do that, and I think that's a very commendable quality. He also, in terms of specifically with health, he has some very good ideas of what he would like to see, and he has discussed some of that with me. Things like how do we expand primary health care. He would like to see more of that being done, and we have worked on a plan of how we're going to do that. So some of those programs you will see us roll out next year. So in terms of quality, I think he has excellent leadership qualities, and he is very compassionate, meaning that he wants to see things done for people. And when people are in distress and they reach out to him, he wants to really help them. And in the health sector, you know that we'll have a lot of persons who are affected one way or another by various illnesses and so forth. And a lot of time when they reach out to the president, he often would try to get us to resolve some of those issues. So I think that shows that that quality that maybe many people are not afraid with.
Thank you very much, Dr. Anthony. Viewers, thank you very much for joining us this week. You've been looking at Focus with Big Smith. My name is Leroy Smith, and our guest today was Dr. Frank Anthony, the Minister of Health. Do join us here again next week. Thank you very much.